My dear friends, antibiotics are among the most powerful tools in modern medicine. They have saved millions of lives by treating serious bacterial infections. But today, their power is at risk, not because antibiotics suddenly failed, but because misuse is making them less effective. Antibiotics work only against bacteria. They do not treat viruses. This means they do not cure colds, flu, most sore throats, viral coughs, or many ear infections. Taking antibiotics when they are not needed offers no benefit, and it causes harm. The biggest danger is antibiotic resistance. When antibiotics are used incorrectly or too often, bacteria learn how to survive them. These resistant bacteria can then cause infections that are harder to treat, require stronger, more toxic medications, lead to longer hospital stays, and, in severe cases, result in death. Antibiotic resistance is now a global health threat, responsible for millions of serious infections worldwide every year. Misuse happens in many ways. For example, taking antibiotics without a prescription, for viral infections in the wrong dose, for too short a time, and sharing antibiotics with others. Stopping treatment early, even if you feel better, is another situation that allows the strongest bacteria to survive and multiply. Antibiotics can also cause side effects. These include allergic reactions, stomach and intestinal problems, disruption of the normal bacterial balance in the body, and serious complications in vulnerable patients. So, antibiotics are not harmless medicines. They must be used carefully and responsibly. What can you do? First, trust your healthcare professional. If an antibiotic is not prescribed, it is because it is not needed. Second, take antibiotics exactly as prescribed, the right dose at the right time for the full duration. Third, never use leftover antibiotics and never give them to someone else. And finally, remember, protecting antibiotics today means protecting lives tomorrow. My friends, correct antibiotic use is not only a personal responsibility, it is a collective duty. When we use antibiotics wisely, we preserve their effectiveness for ourselves, for our children, and for future generations. Knowledge saves lives when we use it correctly. Thank you.